Morning, everyone. My name is Saurav Jain. My pronouns are he and him, and I'm one of the team members here at SEARCH, which is the Center for Excellence in Rural Sexual Health. I work and live in Bendigo, and it is my pleasure to welcome you all to the SEARCH 2022 Sexual Wellness Professional Development Series, which is currently held on a monthly basis for the entirety of 2022. Before we begin, I would like to make a quick acknowledgement. On behalf of SEARCH, I would like to acknowledge the Jaja Wurrung people who are the traditional custodians of the land that I'm speaking you from, which is Bendigo. I also acknowledge the traditional custodians of the land on which each of you might be joining from and working from. We extend this respect to elders past, present, and emerging, and to all the Aboriginal and Torres Strait Islander colleagues joining us today or work with us. It would be wonderful if you could introduce yourself and acknowledge the country that you're joining from using the chat function. Before I hand over to Shannon, one quick note about housekeeping. There will be time for Q&A at the end of the presentation. Please use the Q&A function to drop your questions as they occur through the presentation, and I will do my best to collate all of that and post them to Shannon towards the end. And without any further ado, over to you, Shannon.
Thank you so much, Saurav. I just love that right on cue, I have like one of those trucks that shreds trees in the background. So hopefully that will affect the sound. Thank you for the welcome. And I am on Wadawurrung country here in Ballarat, just across the way. So we also like to pay our respects to elders past and present. And thanks for joining in. To give you a quick overview, I just wanted to kind of outline who are women, who are Women's Health Grampians, what's our work and my role. I'm going to provide you with some context for the challenges that we see for sexual and reproductive health across our region. And then I'm going to kind of dive into two examples of our work. So looking at condom access and abortion advocacy, I'm hoping by sharing those, I can kind of get into how we approach building support for sexual and reproductive health and wellbeing, what resources and tools we use, what evidence we draw on, what partnerships we call on, and I guess what's helped and what challenges still remain for us. So let's jump in here. So Women's Health Grampians, in case you don't know, we sit in the western part of Victoria. We're one of 12 women's health services across the state. So there are 5 rural and 4 metro, and also 3 statewide. So they include Multicultural Women's Health Victoria, and Women with Disabilities. So you probably have a women's health service wherever you are that you can connect with. Primarily we're funded by Department of Health and Department of Family Fairness and Housing. And we lead primary prevention health promotion across the areas of gender equality, preventing violence against women, and sexual and reproductive health. Here in the Grampians, we have 11 local government areas, and we span across sort of the major towns from Ballarat, Ararat and Horsham. So we kind of go across to the South Australian border and then into the edge of Melbourne, if you like, at Melton. And what about me? So I've been doing this role for 10 years. I now have this title of Sexual Health Advisor. And really what that means is I get to think about sexual and reproductive health all day, every day. I get to bug my team about it. So my other teammates tend to focus on gender equality and prevention of violence against women. And then they'll call on me if they want some input around sexual health and what we can do there. I get to lead partnerships across the region, thinking about ways that we can improve rural women's access to sexual and reproductive health. Really, we try and translate policy into action that's relevant for our region. So we're pretty eagerly awaiting the second Victorian health strategy to see what that looks like and what opportunities that might bring. I've been lucky enough to be part of significant research findings that highlight the barriers that women face. And I think I'm into my 3rd cycle of municipal health and wellbeing planning, trying to influence governments to get involved in sexual and reproductive health, and mostly that means annoying them about the lack of condom access in different parts of the region. As part of a small team and often a solo worker, partnerships are absolutely critical to what we do and to our success. And we're in a region where services are definitely few and far between. So I'm always inspired by the clinical champions that I get to work with across my region who never waver in their care for patients and their willingness to pursue improvements to the service system. So I really love that part of my work, that I get to provide backup and support to them wherever I can. And I'm equally inspired by the opportunities to connect across the sector and with rural colleagues like the SPHERE team, who are always a constant source of advice and counsel. So I have definitely booked my ticket to the Sexuality Conference. So this will be my 4th one. So make sure you've done that if you haven't already. And I look forward to seeing you there. So what else? So primary prevention health promotion. I find that often people don't know what health promotion is. I don't know whether they think we're selling vitamins or they think the women's health part means that we're seeing patients. So we're not medical, we don't see patients and clients. We're really advocates, I guess, for what are the issues for women and how can we look to improve them. I quite liked this illustration. I feel like my role is absolutely about connecting the dots. So we're finding the data, we're building the pictures of gaps, we're looking at barriers, issues, we're trying to tap into the knowledge base, the evidence, the best practice. We're drawing insights about what the issues are and how we might overcome them. I think hopefully with wisdom that I've managed to gain over the 10 years, but maybe perhaps a little luck is often involved. We're trying to make an impact. So we're trying to make that experience for women when they're seeking services to be better. So our focus really has been on timely access to care and to increase reproductive choices. I feel like I'm sifting out those dots, I'm sifting out that information. I'm trying to package it up in a way that can set the conditions for change to happen. We're trying to support our partners. So we're trying to find out what do they need that makes sense to them, their setting, their organisation, to help them make change. When Sarav, I can tell you a little secret, when Sarav called me about doing this session about sexual wellness, I was actually speechless, which is quite a rare occurrence for me. But I had to really think about it. Sexual wellness, like what is that? So I was really thinking, is it, I think I spend so much time looking at what needs fixing. I thought, is it real? Is it attainable? In a rural context, could we have sexual wellness? I felt like it was a mythical thing that we might need to go to a day spa to get or to meditate on, and it felt very much aspirational. But the more I thought about it, I thought I'm extremely driven to aspire for better sexual health in my region, and that could be a session worth talking about. So here I am. So we're here to think about how do we build support? How do we build support across the Grampians region for sexual wellbeing? I thought by using those examples of condom access and abortion advocacy, we can convey a sense of what we're challenged by and what rewards we see for the effort that we put in. And I'm hoping that you might take away ideas or inspiration, that you might find opportunities to seek out your own ways to improve sexual and reproductive health, that maybe you can help connect the dots and lend your support in your region wherever you are. So Grampians region, for anyone who's not working in the Grampians region, I just thought I'd share some of the context or what we see in sexual health here. Probably not dissimilar to people working in other regions. We know rural and regional women often have long distances to travel for services. This has often been the case. For us, it's about surgical abortion is the biggest gap that we see, and quite often women will need to travel to Ballarat or to Melbourne to seek those services. So while we have some limited services in our region there's quite often a need to travel. Doctor shortages are a big challenge. We had, for example, recently the news of the TriStar chain going into administration, and that would affect towns like Horsham, Ararat, Avoca and Ballarat, in towns where there's already doctor shortages and waits on getting doctor's appointments. So we worry about the timeliness of being able to seek sexual and reproductive health care. So when you need that script renewed for contraception, when you're worried about an unplanned pregnancy or an STI, they're not really things that you can wait for. Concerns about privacy and stigma always remain. So whether that is seeking care and wondering whether, you know, your pathology request will be kept confidential, whether you'll run into someone at the doctor's that you know when you're asking for something like abortion that you're a bit nervous about, or you know, even going to the chemist for condoms or pregnancy tests. It all kind of matters. Who will I see? Who will know me? Will I be judged for seeking out the thing that I need? Our the health services that we do have are amazing and they're doing a great job, but often they're the solo provider in a town and they are calling out for support to share the load. So as soon as you have someone that goes on leave or they're fully booked or, you know, sick leave, COVID, it's really hard to get cover in those towns. So we have some Horsham where we have one medical abortion service doing great work, but they would love someone. If you're in Horsham and you're able to help, we'd love you to join in and help share the load. What else do we know about the Grampians region? So we typically have high teenage birth rates, and that's a trend that's continued. Currently, the data shows 4 of our local government areas are in the top 5 in Victoria, and 8 of our 11 local governments are above the Victorian average. We don't, I guess it's always difficult to know why that persists, but that is a trend that has continued. Chlamydia is really the highest notification of STIs that we see, and we have 5 local government areas with chlamydia rates above the average. So that's a trend that I'm often watching and wondering what that might be about. And unfortunately, we do have high rates of family violence, and that includes high rates of sexual violence. So we have 4 of our LGAs making up the top highest in Victoria for sexual violence. So that's a consideration when we're thinking about our work. So condoms, why do we think about condoms? Really, I feel like condoms is a great place to start. I feel like it's an easy place to start. It lets me test the waters with people's willingness to have a conversation about sexual and reproductive health. I feel like most people feel quite safe talking about condoms. It's a preventative measure. If anyone's looking a bit scared or a bit nervous when I start talking about condoms, I definitely know I'm not going to have the abortion conversation. So it gives me a gauge. It's kind of my milestone to check in and see where people are at. How we approach condom access is through the municipal health and wellbeing plans. So as you might know, the municipal health and wellbeing plan sets out 10 priorities for action. The councils come together and they bring all the health and wellbeing partners that are working in that region together to talk about what can we do, what can we prioritise, what 3 or 4 priorities will we choose from the list of 10 to work on. Now, this is like I guess it's like my Logies event or something. Like, this is my big moment to pitch sexual and reproductive health and make it sound more important, more exciting than any of the other priorities. And that is a pretty tough ask. So we've got some tough competitors like healthy eating, active living, mental health, and they tend to take priority over sexual and reproductive health. But I will do my very best in these meetings to convey the story. What is the story of that council, that local government area, that means that they must invest in sexual and reproductive health? The other part of that too is, even if I don't get it on the priority list, it's worth having the conversation with all of those health and wellbeing partners to get them to see that sexual and reproductive health is important and it needs to be considered. And hopefully by doing that, we kind of normalise, we champion the cause, we raise awareness, we destigmatise, we try and normalise sexual and reproductive health. So even if someone chooses to prioritise mental health, for example, we can get them to see the links between mental health and sexual health outcomes. If you happen to be part of these health and wellbeing planning communities, I absolutely urge you to come forward and cast your vote for sexual and reproductive health if you get the opportunity to do so. Often we are a lone voice in these planning meetings and planning cycles. So if you have any passion towards sexual and reproductive health, we need your help to get us on the priority list. If you're a community member, you can always be part of the council consultation process. So there's always opportunities to be surveyed and written responses into council. So often people won't think about sexual and reproductive health. It might not be the first thing that they think of. So if you are willing to kind of put that voice forward or help other people put that voice forward, it's definitely worthwhile. So what do Women's Health Grampians do? We start the process by that idea that we're trying to build the story. What is the story that will convince council to invest in sexual and reproductive health? And we provide each council with a gender info sheet. So that really is scanning the data. So we use something like the Women's Health Atlas, and we look at the data that matches those 10 health priorities, and we'll give the council a summary of each of those. So what in that data tells a story about the impact of a health issue for women. We give them a brief gender analysis, and we give them a summary of important statistics. So here I've just put on the slide some information that we noticed in Pyrenees. So at the moment, Pyrenees have a particularly high rate of chlamydia, and it's on the rise, so it's trending upwards. We also know that there are no local sexual health services listed with 1-800-MY-OPTIONS, and through our work with council, we know that their condom vending machines that they had in public toilets had been vandalised. So it starts building a bit of a picture about an opportunity there of what is going on with those higher rates of STIs, and perhaps what supportive things could we put into place to improve the outlook for Pyrenees. So once that happens, that kind of goes through to the council before they draft their plan. And then once council have drafted their plan, we'll have a look at the plan and we'll provide feedback. So we stay very close during that planning cycle with council about opportunities to improve any of the priority areas that we work on, or strengthen or highlight issues for women. We're kind of giving a gendered review, if you like, of the plan at that point in time. Most councils seem to appreciate that work that we put in at that point, and it seems to work well in setting us up for the next phase when we go into action. I'll just have a quick look at, so one of the resources, we also linked a resource for the councils here, and I think even the search team might have had a little bit of input in the background to this resource, where the Department of Health had set out how to improve sexual and reproductive health in different settings, and I found that to be a really practical way. It's not it's quite common for councils not to perhaps see their role in sexual and reproductive health. They think, what has it got to do with us? And I found that these were really practical examples, really tangible things that people could look at and take inspiration from in building their plan. So you can see here, I've just pulled out this one example where in early childhood settings or schools, you might do something as simple as provide a dedicated space, a dedicated private space for discussion of personal and confidential matters. So it's not, it's not solving all the world's problems, but it's just a really good starting place for people to think about how do we create respectful, inclusive, support for sexual and reproductive health. So some of the actions that we suggested were around, let's advocate, let's get the local providers registered with 1800 My Options so that we can promote that service and connect communities with the help they need when they need it. We talked a lot about whether they had condoms in public spaces. So do they need to install or maintain that provision of condoms? And we talked about implementing health promotions or campaigns. So I loved this terminology within that resource about the deep support for destigmatising sexual and reproductive health, sexuality or gender identity. So that was really useful as a starting point for working with council. What happened? So out of all of that talking and planning and strategizing, we had this cycle, 4 councils exploring ways to improve condom access. So that was a pretty, that was an outcome better than I expected. It's probably better than some of the previous cycles where I maybe had 1 or 2 councils thinking about it. And they think about it in different ways. So you may have been aware that SPHERE had provided some free condom dispensers, and that was really useful to get some people started in thinking about this. By offering them the free condom dispensers, we had Wimmera take them up and install them in their youth and library spaces. And Horsham got creative and put them in their town hall building. We've got Northern Grampians having a look at it through their community health team, and we've got the Golden Plains Shire thinking about how we can position this, particularly for their newly built youth hub space. So amazing to get all of those shires started. It's a really good way to start the work with them, and then we think, what else can we connect this to? So this might be things like the health promotion campaign of Be Proud of Your Choices that was offered through the Shout network. They're great resources, posters that we can put with those dispensers. Or we might get the 1800 My Options stickers and have those with the dispensers. So starting to think about the health information that goes with the condoms. So it's a really good foot in the door in working with council, in building relationships, getting a sense of how an organisation views sexual and reproductive health, and who are my key contacts, who are my allies in doing this work across the region. Things like training, we also can start promoting things like the 1800 My Options micro-credential training youth teams to better understand about contraception and referral options for sexual health. So I was pretty happy to see where we're at the moment. You can see down the side there, we've also got 4 other councils that have had a go at condom vending machines. They've happened in different ways. So some councils prefer to go with a service model where someone else installs the machine, they don't have to think about it, they don't have to collect the money, restock it, and that's worked for them. So we've got a couple of different approaches there. Where are we at? So condom access, the challenges that I still see and is really, really common is budget. It really comes down to who will be accountable, who's accountable for being the person that introduces condoms into an area, an organisation, a space, and whose budget will it sit in. So there seems to be, that uncomfortableness about who's going to own this. So if you can help people understand what the costs might be, where it might sit, that really goes a long way to getting them feel comfortable with taking the next step with condoms. So the free condom dispensers from SPHERE were a really great example where people were happy to put them in, but then they didn't know where to put the refilling expense through. So helping them navigate that works really well. The benefits that I see, it's absolutely low cost, low effort. It can be as easy as you want it to be. If it can go in even as a trial, so we started in Ballarat as a trial for 12 months, and that's then extended now into 2 new more machines. So it's a great starting point. It helps us build that network of supporters. What do we see as the future? So part of our work is helping organisations meet their responsibilities under the Gender Equality Act. So a great example, it's actually sort of come through learning from the Shout Network, where one of the councils, I think it was Swan Hill, put condom vending machines as a standard issue item in their public facility strategy. So when, say for example, when a public toilet is reviewed or needs to be renovated or built, they look at what needs to be within that toilet, and condom vending machines is one of the things that they think about. So as part of the Gender Equality Act, we have the opportunity to seed that strategy as something that is reviewed and looked at every 2 years. And it gives us a chance to, again, to build the case for what might help make public spaces more inclusive and safe for sexual health. So that is useful to keep in our minds as a tool that we can draw on, and another planning cycle that we can attach to. Youth consultations, I'm really keen to get talking more to youth about what else, what next, beyond condoms, what do we need to do? I was quite fascinated that in a consultation in Horsham, we had a sense from young people that they didn't want to use public toilets. And I don't know if that is a symptom of COVID, that we're going to wait and go at home. You know, we don't want to go to the public toilets if we don't have to. So is putting condom vending machines into public toilets the best use of our effort? So I'm really keen to get talking more to youth about that. And what support can you call on? So I mentioned the SPHERE Yakvik Shout team has been a great source of inspiration and learning for me. Hearing about other people's work and how they approach things. I've met other people in my region through that group, so I found that really useful. The Women's Health Services, so someone like me sits in your region, talk to them, meet them, help them if you don't know them already. And community health, so often that idea about budget or funding, sometimes community health might be able to tag their harm minimisation funding to a supply of free condoms. So that's worth exploring when you're thinking about condom access. So hopefully that's enough about condoms. And we can get into abortion. I have been thinking about abortion advocacy for a long time. I started, the very first thing that I did when I arrived at Women's Health Grampians in 2012, when I was about 10 years old, was do the Victorian Rural Women's Family Planning Survey. So that was a survey right across the state, talking to rural service providers about what they saw as the barriers to women's sexual and reproductive health. And really the main message that was carried from that survey was that there were no abortion services beyond the Melbourne Ring Road. So that gave us visibility of that access issue. And that was really the stepping stone to the next things that happened for me in the region. You can see there in 2013, we had medical abortion being licensed, and we thought, great, this will solve all our problems. Everyone will get on board with medical abortion provision. That didn't really happen. So we kind of struggled through. Safe access zones were a good support. First statewide sexual and reproductive health strategy in 2017 was an interesting time. At that time, we also undertook a research piece with Melbourne University, and we were looking at talking to GPs. So when a patient presents with unintended pregnancy, what happens? What do they know about the referral options? What do they know about local services? What services are they providing? And we came up with a very unexpected finding that we had a high rate of conscientious objection. We knew that there were gaps in knowledge about service provision and referral pathways, but we didn't expect people to describe that they would prefer to refer on. So if they saw a patient with unintended pregnancy, they would prefer to refer on to someone else. That research really did get us noticed and put us in a position to get one of the funded sexual health hubs. and Ballarat got started as a sexual health hub. So Ballarat Community Health got going in about 2018. We did a lot of work then. We invested in the women's clinical champions coming to the region. We attracted about 60 GPs, providing that medical abortion information training session. Unfortunately, that didn't translate into a lot of provision. While people were willing in the session, we haven't seen that turn into providers. But we did have a very brave team in Horsham that got going, and we did as much as we could to support them. And we also had a look at the local health pathways with Western Vic PHN, so trying to smooth out some of those referral issues and service gaps. So I'll just give you a quick look, just a couple of quick summary pieces from the research. So what you can see there on the left is participants had conflicting information about abortion services in Ballarat. So when we said to them, who are you referring to? You can see there that the answers were very varied and confused. So surgical and medical, maybe surgical only. We might have surgical. We might have had it, but we don't anymore. Maybe it's in Melbourne. I think it's in Ballarat and Bendigo. Maybe it's in Horsham. There's nothing in Horsham. So there was a lot of confusion. The good news is that when we went back in 2019, some of that confusion had smoothed out a little bit. We had a 16% increase in GPs who would always discuss medical abortion. So I think that was the biggest improvement from the survey, that we had more people understanding that medical abortion was an option. And we also had 60% of participants saying that the number and range of services and referral pathways had improved. So that was a great result, but they also said we need to do more. So we were conscious that we still needed to do more. What else? The teleabortion was still quite low, and I kind of wonder if we went back and revisited that now with all that's happened with COVID and telehealth, whether that would have changed. I imagine it would have, in people seeking out telehealth as an option even for this. So services. So 1-800-MY-OPTIONS was an amazing piece of evidence for us. This is we've got those lines in there to give you an indication of that is the part of the region that I work in, and services are very thin on the ground and the gaps are enormous. So there's great opportunity to try and bridge those gaps and bring in services to share the load. So even where we have services in Horsham and Ballarat, we can very much see that there is an opportunity for that service provision to be shared. At the time of this being introduced, I wanted to be able to promote 1-800-MY-OPTIONS as my first initiative, but I felt I couldn't do that until we had it as locally relevant. Like, we need those local services to be there before I could start promoting it. So we've done a lot of investment in trying to make services aware of the opportunity to register and capture patients locally from their region. It's been an evidence piece. I put this map on the table in front of health planners and providers, and they can see the gap without me having to talk about it. So this was a huge strength and a huge step forward in my work, in being able to show this and demonstrate this. And I just wanted to give you kind of I guess a bit of a case study. What's it like to be a woman? So if I'm in the Wimmera, what's the situation there? So this is current, that a woman in the Wimmera might have access to 2 male gynecologists, but neither of those provide abortion. That you will need to travel to Ballarat for surgical abortion, and that specialist gynecology, including childbirth under 36 weeks, will be in Ballarat. So that creates challenges for women in Horsham. There's one local provider of early medical abortion, and they run a very busy service already, so it's not always possible to fit women into their schedule, and there's no backup. So no backup for sick leave or holidays. Many women many women that are seen for medical abortion in Horsham don't drive, have young children, so that travel and coordination of leaving town and travelling long distances is extra pressure and stress, and that they do have a requirement that patients need to be within a 65-kilometre radius or stay in Horsham if they're outside of that radius. They've managed to create good relationships, so we're pleased that access to ultrasound and pharmacy supports for that services have improved. But you kind of get the sense that while we do have one dot on the map, it would be great if we could extend that out and increase that and make it a bit easier for women. Now, this is hot off the press, big news. This is brand new. And you might have seen this through Women's Health Victoria, but this for the Grampians and for me is really important. We've got new data sets on the Women's Health Atlas that highlight unmet need for comprehensive and sexual and reproductive health care. And really this is showing for me the shortfall between services provided and services received in a local government area. And this is a huge step forward to helping me show or prove need. How do we plan better health services based on demonstrated population health needs? So you can find these data sets on the Women's Health Atlas for early medical abortion and also long-acting contraception. And I will show you just a quick view of the early medical abortion ones here, because this is super interesting. So the statewide view, what you can see here is the blue-green at the top. What that tells me is there's a fairly even demand for early medical abortion by patients across the state. So the blue-green is kind of telling me most regions are quite similar. And you can see there the Victorian rate average of patients, seeking services is 4.6. and the Grampians is 4.3. So we're not dissimilar to the state average. What you see at the bottom is a lot of yellow. Now the yellow means no service provision. And if you remember the map that I showed you before, I'm in that western part of Victoria, and that's a lot of yellow. So we have 7 local government areas with no service provision. There are 11 rural and regional local government areas with no service provision, and I have 7 of them. So I am doing something wrong. I think maybe what's good here is when we kind of shift up a little bit and we look into SPHERE's territory, I feel like SPHERE's territory might be doing a bit better than me. So if we ever had a case for SPHERE being funded and coming to work with me in my region, that would be, this could be it, and that would be amazing. I'll just bring in the Grampians. So you can really kind of, when you zone in here, you see this yellow. And I've just pulled out one there to show you. So Northern Grampians, we have the highest patient demand there at a rate of 6.5. And then down in the service provision, it's showing a rate of 1. So you can really see there's that mismatch between patients seeking services versus locally provided services in the Northern Grampians. And that's the same for Ballarat and for Hepburn. And then we have a number of those 7 LGAs with no service provision. The good news story about Horsham is we can see there that the patient demand and local services are quite evenly matched. So that's a great news story about that clinic offering that service locally. But as we know, offering that locally by one provider is just not quite enough. We just need a little bit more backup and support for that team. So abortion advocacy challenges, it's slow work. As you can see, I've been thinking about this since 2012. It's definitely limited by lack of funding, but also there's a stigma about talking about it. There's a reluctance to have your name associated with it, whether you're a doctor, whether you're a health service. There's an avoidance. Maybe someone else will do it. Ballarat Sexual Health Hub, they've got that in their name. They'll look after it. It'll be okay. But we can see even in Ballarat, we need some support for the Ballarat team. The benefits, I feel like, you know, one of the best parts of my job is the amazing clinicians that I get to work with. They're always inspirational and they always do their utmost to support patients where they can. I love the sector collaboration and support. I think even during COVID, it's been more obvious that we've been able to pull together and connect in new ways and support each other. I love that we can make sure that rural voices are being heard. So I'm really passionate about making sure that the issues that affect us out in rural and regional towns are heard at that wider, you know, statewide planning and federal planning level. The support that we have, the 1-800 My Options team are amazing and we're so lucky to have them, and I love being able to call them whenever I have a really tricky thing, which I did yesterday. The SPHERE training and clinical networks are a super support, so that we've got these online resources for best practice, for e-modules, for talking about case studies, access to someone like Patty Moore at the Women's to talk through scenarios with you. If you're a lone GP working out in a region, that's amazing support. The Women's Clinical Champions, having them refunded is fantastic. We know that we've done some work to inspire GPs to come into this space, but there's more that we can do. And also the SPHERE training, research and community of practice. I think some of the packages of support that I'm seeing now are some of the best that I've seen. So I'm pretty inspired by that. So have we achieved sexual wellness? Is it still aspirational? Maybe, I think so. But I think, it kind of reminds me that we're drawing on these partners, these evidence, we're drawing together the best practice, the wisdom. What can we take to support each other to make change happen? And I think for you, I would really inspire everyone to be brave, to start conversations, to be champions for change, to share things, to join networks, explore further learning. Don't think that sexual and reproductive health is there. Check, find out, ask questions and prompt people to do more and be more. So that would be my call to action to anyone who has a feeling of needing to do something in your region. How do we do, Sarav? Right on time?
Yeah, right on time. And brilliant presentation, Shannon.
Hopefully we have questions. Otherwise, I have to sit here for 15 minutes talking to you.
I had a comment that I wanted to make. So I looked at the attendance, and it is a little disappointing that we did not have a single male. And this is me trying to assume people's gender based on their first name. But we do not have a single male participant in the audience, which is kind of disappointing and shows the problem that we are facing in this space when it comes to women's health and their engagement, that maybe males are feeling a little threatened, which shouldn't be the case, because it's all about equity and providing equitable projects and initiatives. So a little disappointing, but something that needs to be addressed maybe in the early stages of life, during education time, during school, during university, where people are able to take up courses which focus on gender health, because we know there is inequity there. I had a question that I wanted to ask. We see a lot of discussion about Roe versus Wade and how everyone is going on and on about how US has this issue about abortion and people won't be getting access, people with a uterus won't be getting access to abortion services. We have a major problem in Victoria as well. We have services which do not want to prescribe abortion because of their religious beliefs, or because they just don't want to be the abortion clinic, or pharmacists not dispensing MS2-step, the medications for MS2-step, because cultural beliefs, religious beliefs, and whatnot. We need to talk more about this as well. Instead of focusing on US, which might be a little out of our scope. We need to do some discussion about this as well. And thank you so much for bringing this up. Is there anything else that you would like to add on that, based on the whole conundrum which is going on about Roe versus Wade?
I was lucky enough to have a meeting on the Thursday before the announcement with the hospital here, at the hospital and the women's. We had an abortion roundtable discussion with regional stakeholders, and we had the most amazing positive discussion with people really wanting to make change. And I was on such a high. And then Saturday morning, I think I heard the news of the Roe versus Wade decision, and I thought, oh gee, come on, this is not happening. But interestingly, I was quite nervous when that happened, about people might hesitate and not want to make change or make a move. Right now, they might think, no, this is not a good time, let's just wait. So I thought it might delay things. But instead, I feel like it has inspired people to want to do better. And so that's the good news message that I can tell you out of that. I went to the first protest in Melbourne, and you might be pleased to know that there were heaps of blokes in the protest. There were people of all ages, there were families, there were dogs, there were people in costume, like there were all sorts of people at that protest. So I felt really happy to see a lot of young men in that crowd calling for change. In terms of us here, you know, it is absolutely part of our core business that we try and overcome these challenges and barriers about, you know, conscientious objection. And really, I guess how we do that is to try and make more service options and pathways available so that people don't hit those providers that are unsupportive. But I know it does still happen, and it does still happen in my region. So try things like 1-800 My Options being obvious and clear just means that hopefully people will find help when they need it. Sometimes the objections can be kind of soft, like they're happy to refer on to someone else, and sometimes they can be, you know, underlying things that are not spoken about, and they cause delays and referral in the system. So it is a really tricky area, and we try and share the information about real experiences for women, so that people can empathise and appreciate with what that's like and why timely care is so important. So we're definitely advocates that are inspired and will keep going.
That's nice to hear. The other question that I was thinking about throughout the presentation was how Royal Women's Health is doing this advocacy piece, because there is a need for this advocacy to be done in Ballarat and the areas around it. What would be the ideal solution to this, according to Women's Health Grampians, or your understanding? What would be the ideal scenario there?
I guess we need the funding, as I mentioned, is the tricky part, but ultimately we need opportunities to provide services within the region for local service provision, but also for skills. We need to have opportunities for workers to be trained and employed using those skills, so that those skills are retained within the region. So we very much need surgical abortion provision to be extended in the region. So the guidance of the women's clinical champions to mentor and support us through that are really important. We need health planners to see it as a priority and be able to create funding, you know, and a place for that. And then we need those medical abortion providers coming on board. So we need more clinics, more GPs getting trained up and being willing to provide services. So things like the SPHERE ORIENT trial is hopefully a great piece of evidence that will guide some clinics through a nurse-led model of care for implant-on and early medical abortion, and show clinics that it can be done in this way, and it's not difficult and it's not dangerous. It's safe and it's easy and it's okay. So I'm really looking forward to the outcomes of that trial, and hopefully getting someone in my region to participate.
Okay, one final one from me. I promise. Coming from a culturally and linguistically diverse community, I feel like I need to ask this question for my brethren. More often than not, people coming from culturally and linguistically diverse communities, people coming from LGBTQIA plus community, people coming from Aboriginal Torres Strait Islander background, people coming from young people coming from regional Victorians, they feel that the burden is the highest on them as compared to, let's say, Melbourne Metropolitan, Anglo-Saxon Melbourne Metropolitan. Do you see any way for the access to contraceptives, access to MTOP or STOP, improving more for these marginalized, not marginalized, but communities which might be at risk of being at a higher risk, actually, to improve on some of these things? Do you see that?
Yeah, I didn't mention it specifically, but I absolutely agree with you. It always worries me that we don't seem to have the most basic kind of Medicare ordinary service, English speaking, understanding how to navigate our service system level right. So if that basic level is not right, then I can only imagine the challenges that you face if you're speaking in a different language, or you don't have Medicare, or you're worried that your visa, I'm pregnant and I'm not sure that my student visa will be okay if I stop studying, and all of those things. So it worries me. And I think the closest that we've got, we just recently through COVID had multilingual health educators working with us, and they were working with women in communities, and I felt like that was a great time to be connected to communities and understand more about what the issues and challenges are and how we can do better. So we have potentially some roles joining our team to think about this a bit more and build that out. So extending beyond, the standard access, what else could we be doing? We have advocates, equality advocates, who sometimes go into health services and share their patient stories, and that's a great way of health services understanding the impact of not having this right. But some of those issues around, health insurance and things are federal issues, and so SPHERE and Multicultural Women's Health do good work in advocating at that federal level as well.
SEARCH is also hoping to address some of these issues, especially around the overseas student health cover or overseas working health cover, with some of the partners in Melbourne, and hoping that we get to influence this document called DEED, which is a document signed between the insurance providers and the government, so that it's easier and accessible for people coming from outside, people coming from different countries to study or to work or to live in Australia, to be able to access healthcare without having to jump so many hoops. Yeah, but thank you so much for that, Shannon, and hopefully things improve for Ballarat, things improve for Bendigo, things improve for all regional Victoria in the future. Was there anything that you would like to add? Any feedback, any questions, any comments?
I don't think so. I think if you are inspired and you live in the Grampians region, we might have some jobs coming up. So definitely look out for those. We'd love to have new people in our team helping us through. Thank you to the SEARCH team, who always do amazing work, and things like resources and content that I can share, training, the Busy Workers Youth Guide, things like that are amazing support to me in being able to do my job and share new things with the region and start conversations. So thank you to the SEARCH team and all the partners that we work with. Really, like we can't do what we do without the help of people like the Royal Women's, the 1800 My Options team, and the services across the region. So I think that's it.
And thanks to you for doing the hard work.
It's funny, after 10 years, sometimes I think, have I still got new ideas for new regions? And then I see something like this data and I say there is more work to do, and I keep going. And I think it is my life's work. So Women's Health Grampians has stuck with me for a bit longer yet.
I think they'll be happy with that. And thank you so much for taking the time out to do this with us today. I had a quick announcement to make. The recording for this session would be available on the Search channel. If you would like, if the audience would like to circulate this to their channels, or if they would like their colleagues or workmates to see and have some inspiration from Shannon's hard work in Ballarat, feel free to do so. We'll send an evaluation feedback, which would have the link for that. So thank you so much for joining us today.
Thank you.
Thank you, Shannon. Take care.
See you soon.